This is a community analysis of southwest Gainesville, Florida, bordered by I-75, Newberry Road, Highway 441, and Williston Road. Though originally a Timucuan Indian village and once owned by a Spanish merchant, the city of Gainesville was founded in 1853 and named for the Seminole Indian War General Edmund P. Gaines. Though initially the economy relied on cotton, citrus, and vegetable farming, record-setting freezes led to the phosphate and lumber industries. The University of Florida was established as the East Florida Seminary in 1853, and the economic stability of UF has led Gainesville through the industrial collapse and the Depression era, and continues to support and generate population, economic, social, and cultural growth within the community today. Educational, cultural, health, and social resources, as well as job opportunities, support local residents, surrounding communities, and nearby cities. UF offers multiple diverse programs of study and free or inexpensive services to the public, such as oral exams from the School of Dentistry. UF also supports P.K. Young, a public developmental research school from kindergarten through 12th grade. The UF Cultural Plaza supports cultural, historical, and educational growth in the community and features a performing arts center, an art museum, and a natural history museum. Southwest Gainesville is similar to other college-based communities in its support of local education, cultural arts, and social events. UF also conducts a vast amount of successful research to benefit local and global populations with advancements in health and science. Multiple religious and spiritual organizations are also found throughout the community to support local parishioners. Housing consists of well-maintained multiple-unit properties, single-family homes, and low-income housing. Student housing is also available to support students with limited financial resources. However, there are no shelters for the homeless within the community. Most city, state, and federal resources are located a few miles outside the community, but within city limits. In addition, the homeless tent community and center are located several miles to the east, along with the state health department. Heavy parking and traffic also occur when the university is in session, particularly during football season, and causes parking and driving difficulties for local residents. Many residents live below poverty level and struggle with the cost of living, including elevated gas prices. The population primarily consists of students, healthcare professionals, and university faculty. Many professionals find it difficult to live in a student-based community due to the noise, congestion, limited parking, and limited living spaces. The community has a high risk for the spread of infection and disease due to proximity, as dormitories and large social gatherings significantly increase the risk for infectious diseases. STDs are also prevalent, with chlamydia listed as the most common infectious disease and likely related to poor condom use among college students, limited awareness and knowledge, and poor changes in behavior or personal habits. Binge drinking is often associated with college-based communities and increases the risk for harm. Evidence shows adulthood alcohol problems and dependence are associated with higher alcohol consumption in late adolescence. In addition, college football games at UF have been associated with an increase in population, binge drinking, and number of alcohol-related arrests. The majority of restaurants offer food and drinks that are high in calories, fat, and sugar, and students typically have unhealthy eating behaviors. Soft drinks with added sugar are associated with diabetes and obesity, significant risk factors for heart disease. Diet soft drinks with aspartame also have been associated with cancer, and cancer and heart disease are the two leading causes of death in Alachua County. Health-related resources are available to the public at multiple levels of affordability. UF Shands Hospital and Children's Hospital are well-respected, highly ranked healthcare facilities. Shands Children's Hospital was recently designated a baby-friendly facility, which is a global hospital initiative that recognizes successful programs of optimal care. The VA Medical Center also provides affordable health care services for military veterans, and Health Street is a community health promotion facility that offers free services and supplies. A skilled nursing facility, a long-term acute care facility, multiple home health care services are also available throughout the community at varying rates of affordability. One Appropriate Healthy People 2020 objective for this community proposes a reduced consumption of calories from solid fats and added sugars. Poor nutrition and eating habits are significant contributors to the development of heart disease and diabetes, both significant health concerns in the Southwest Gainesville. In addition, proposing a reduction in the percentage of adults over the age of 17 with reports of binge drinking in the last 30 days would also be an appropriate objective. STD1 also proposes a reduction in the rate of chlamydia infections in the adolescent and young adult populations. As Alachua County is ranked third in the state for chlamydia infections, this is a significant issue for this community. Running trails, parks, crosswalks, and bike paths are well maintained and updated to encourage frequent and safe use. However, some cyclists and many pedestrians fail to cross streets and follow traffic lights appropriately, increasing the risk for injury. City ordinances require law enforcement officials to enforce these ordinances, though many neglect to do so. Injuries may be avoided if cyclists and pedestrians utilize these bike paths and crosswalks appropriately. Though the Public Works program offers adequate and reliable services, many older buildings have insufficient insulation, causing inefficient use of energy, likely increasing costs unnecessarily. Multiple restaurants also have healthy options available, though many do not actually disclose the amount of calories, sugar, and fat included, and they can be misleading. Many residents also do not appear to recycle, and further assessment for convenience, ease, and education may be necessary. In summary, though environmental services may be sufficient and adequate, many residents may not take full advantages of these services. The City Commission, headed by the mayor, holds bi-monthly public meetings to address community concerns and city ordinances, and members of the public are encouraged to participate in the designated committees. City government is also accessible through their offices, website, social media, online videos, and a local television channel. The city budget appears appropriate and adequate, with the primary expenditure supporting public safety, addressing the increased population, number of arrests, and number of injuries associated with college and high-profile sporting events. One concern of the city is policy adjustment for vocal groups of concerned citizens, rather than considering future implications for the public. For example, in 2000, the city passed an anti-rave city ordinance at the insistence of a concerned group of citizens that later became associated with an increased number of alcohol-related injuries and accidents due to the closure of bars at 1:30 in the morning. Also, though the city government may be satisfied with their efforts in regards to community issues, results may not prove sufficient for its safety and wellness. For example, though the city has made a few significant interventions to aid the homeless, most community resources are at a distance from job opportunities. With the exception of city employees and a few committees, the government appears to have minimal direct involvement in public health, leaving health concerns to state, federal, and private agencies. However, proactive policies and interventions may benefit the community's overall health. The first priority diagnosis for the community's health is risk for decreased cardiac tissue perfusion related to poor eating habits. This diagnosis is first because heart disease is a leading cause of death, and poor nutritional habits are a known community concern. The second priority diagnosis is risk for injury related to alcohol abuse. Each year, approximately 97,000 students report incidences of alcohol-related date rape or sexual assault, and 1,800 college students die from alcohol-related unintentional injuries every year. Therefore, reducing the occurrence of severe alcohol abuse is a high priority for this community. The third diagnosis is risk for infection related to poor use of safe-sex interventions. In 2012, Alachua County reported a total of 1,919 STD cases. Education and implementation of safe sex practices is essential to stop further spread of STDs. Risk for unstable blood glucose level related to consumption of drinks and food with a high sugar is also essential. Drinks and smoothies with added sugar are a highly popular drink among residents, and as 27.8% of people with diabetes remain undiagnosed, screening and education for blood glucose control is essential. The next diagnosis is risk for injury related to poor use of crosswalks and bike paths. The state of Florida is ranked among the top 3 in the nation for fatalities of cyclists and pedestrians, as many cyclists are known to bypass bike paths and disregard helmets, and many pedestrians fail to utilize crosswalks appropriately. Concern for community safety is evident. The final community health diagnosis is risk for injury related to poor housing and safety measures for the homeless population, since there are no actual sheltering resources available in the community. However, the risk was placed last, as there are resources available in nearby communities for collaboration. Among developed countries, coronary heart disease is also the leading cause of death, indicating both a local and global concern. In addition, cost-effective options are utilized locally and globally, including public education, smoking cessation, and affordable medications such as aspirin, beta blockers, ACE inhibitors, and statins. Results from research in China are utilized on a global basis, including taking aspirin and Plavix within 24 hours of an acute MI to reduce the incident of death and reoccurrence, and taking captopril within 36 hours of an acute MI to reduce the subsequent incidence of heart failure. However, countries in Europe and Central Asia have been associated with poor patient outcomes and an increase in deaths related to heart disease, including countries such as Bulgaria due to a neglect in following evidence-based treatment for acute MIs, and other countries including Russia, Hungary, the Czech Republic, and Slovakia, because they don't meet the established standard guidelines for treatment of angina. Ranked number 41 in the nation, the Thoracic Cardiovascular Surgical Team and Cardiology Team at Shands Hospital treats a variety of cardiovascular disease processes. UF Health performs minimally invasive valve repairs. They also patented the Florida sleeve, and they repair all types of aortic aneurysms and dissections. The Florida sleeve is a valve-sparing vascular graft for aortic root aneurysm repair in the presence of coronary disease, and has been utilized in other countries as well, including Korea, contributing to local and global cardiac health and wellness. Many residents attempt to eat healthier and lead active lifestyles. However, many residents are not consistent and fail to maintain lasting habits to support optimal health. For residents diagnosed with heart disease, complications with medications is usually reliable. However, diet and exercise often continues to be an issue. Though primary prevention is offered, most medical care is focused towards disease management. Primary prevention may be improved by a community health nurse that offers more frequent, free risk assessments and screenings at times and places convenient for the local population. In addition, education on disease, risk factors, signs and symptoms, and the necessary actions to be taken in the event of an emergency should be provided. Administering accessible and affordable services at the population's convenience may encourage residents to engage with the nurse, increase their willingness to receive and consider information provided, and encourage cardiac health within the community, and overall health as well. Thank you.